Good morning. I am Dr. Gopalakrishnan. Okay, so suppose the patients presented to emergency or OPD with leg swelling or leg pain or fever. So what are the differential diagnosis? First differential is deep vein thrombosis. Second differential diagnosis cellulitis. Third differential diagnosis lymphedema. How do you differentiate among three? Okay. So cellulitis, how do you differentiate? So cellulitis, there is excruciating pain, erythema, reduced discoloration. Then hallmark of cellulitis, there is a puncture mark. Okay. Then hot, warm on palpation. So these are the things for cellulitis. How do you differentiate from deep vein thrombosis? DVT, there is a indurated mass. Okay, that is moves like a mass, side to side movement, there is a pain. Okay. Then lymphedema. Lymphedema is a chronic condition. Deep vein thrombosis and cellulitis is acute condition. Okay. So after diagnosing DVT, okay, so what other things you have to do? DVT is the current problem. Patient presented to the emergency like with DVT. DVT itself is not a full diagnosis. You have to go into the deep. You have to diagnose what is the existing problem. Patient, what problem he has earlier, what disease he has. Okay, you should know the causes for the DVT. How to, what are the causes for DVT? Okay, we can divide into three, A, B, C. Okay, A, antiphospholipid antibody syndrome. Okay, paroxysmal nocturnal hemoglobinuria. Okay, then homocystinuria. Then heading B, Behçet's disease, inflammatory bowel disease. Then C, cardiac disease like dilated cardiomyopathy, severe valve dysfunction. Then cancer, malignancy. Then congenital hemoglobinopathies, not congenital hemoglobinopathy, congenital hemophilias. Okay, antithrombin 3 deficiency, protein C deficiency, protein S deficiency. These are the causes. Among which you have to ask about immobilizations like recent surgery last 3 weeks, immobilization more than 3 to 4 days. Okay, that is very important. So what are the causes for the DVT? So you have to antiphospholipid antibody syndrome, paroxysmal nocturnal hemoglobinuria, homocystinuria, then Behçet's disease, inflammatory bowel disease, cardiac disease, cancer, congenital hemophilias, immobilization. Okay, you before going examining the patient, you should know the what are the things can differentiate, how to diagnose from the history itself. Okay, this how to first cause for antiphospholipid antibody syndrome. What are the history? Antiphospholipid antibody syndrome, there is a clots in the past. Okay, then livedo reticularis, there is a skin lesions. Then obstetric complication like miscarriages. Then thrombocytopenia. Patient may be hypertensive or pulmonary arterial hypertension. These are all features of antiphospholipid antibody syndrome. Paroxysmal nocturnal hemoglobinuria. Patient will give the history of passing brownish or dark color urination during early morning like that. Okay. Then homocystinuria. Usually patient will be very tall. This homocystinuria, one of the differential diagnosis for Marfan syndrome. Okay. So homocystinuria, patient will be very tall. Okay. Next, there is a skin downward dislocation of the lens. Okay. Then osteoporosis, recurrent clots history will be there in homocystinuria. Then Behçet's disease, usually patient will be very young, around 20s. Along with they will have the history of abdominal pain. Okay, oral ulcers in the private parts. Okay, then inflammatory bowel disease. IBD is a malabsorption syndrome. Patient will have weight loss. Okay, then diarrhea, sometimes bloody diarrhea. Okay, then cardiac disease, dilated cardiomyopathy, severe valve dysfunction. Patient will have the dyspnea on exertion, orthopnea. Okay, then cancer, serious illness. Patient will have weight loss. Okay, loss of appetite. You can get the history from there. Okay, then next, congenital hemophilias like protein antithrombin 3 deficiency, protein C deficiency, protein S deficiency. Okay, these are the causes for DVT. So before examining the patient, you should know all the causes. Then you can get the reliable history from the patient itself. So diagnosing a patient with DVT, present diagnosis, then you should know the existing problem, what are the causes like APS or PNA, which one. Then why you should know, why you have to rule out all those things, because that existing problem, that what is the problem patient is having earlier, that will decide the duration of anticoagulation. Okay, thank you so much.